The decline of reported cases of COVID-19 across the country have meant the easing of restrictions. So as we move into this new phase, the way we track and manage COVID, we know is changing. So here to explain for us what that means is Dr. Abdu Sharkawy. Welcome back to your morning.
Thank you for having me.
All right, provinces stopped providing lab tests to most people last year after the capacity was overwhelmed because of Omicron. Without these accurate numbers being reported, how are we basing our decisions off the number of cases?
Well, it's a very good question. I think much of it is based on tools such as wastewater signals, which can be relatively reliable in terms of forecasting how much community transmission is likely to change and how much is currently going on. The challenge, unfortunately, is that this is not present and widely available everywhere, especially outside of big centers. So truthfully, we don't really have an accurate reading in many parts of Canada, including right here in Ontario, without PCR testing. And that worries me, quite frankly.
What worries you about it?
Well, I think we're to a certain extent flying blind right now. With people not understanding what the true magnitude of community transmission is, and with restrictions being eased, there can be a sense of complacency that creeps in that suggests that the worst is behind us. Let's remind ourselves that Dr. Moore mentioned just the other day that he estimates that there is somewhere in the neighborhood of at least 20,000 cases here in Ontario. It's probably much more. I think if we look back during this pandemic, we would never sort of very gently or casually brush that aside, thinking that that is okay. And I recognize that the comfort is based on the idea that the hospitals are currently not seeing an influx of patients with COVID-19, including ICU admissions. The problem is that that can change. And when you've got enough community transmission and it starts to creep up again, that will at some point lead to more hospitalizations and ICU admissions and deaths. And I'm particularly worried because we do have this BA2 sublineage of the Omicron variant. It was at about 5% of cases a few weeks ago. It's now closer to 25%. I don't foresee the possibility of that going down anytime soon if restrictions continue to ease themselves and we decide that masks are no longer necessary. I think we're inviting trouble in the next 6 weeks.
Yeah, why do you think that governments are doing away with masks? You had a tweet recently this week. It says, it's a respiratory virus while I'm wiping every last grocery before it's put away. Now in 2022, it's an airborne respiratory virus while I'm not wearing a mask. Why do you think governments are doing away with masks? You said you don't think we're ready. Why is that?
Well, I think there's a real palatable psychology to saying that we don't need masks anymore, and it's sort of a reward, if you will, for feeling like the hard work is over. The problem is that it's premature. Springtime is coming. I think clearly there are elections that are happening in June here in Ontario. And this is a nice carrot to dangle for people. But while this may be psychologically enticing and maybe politically, opportunistic, it's certainly not scientifically very valid. We know that masking is extremely important as a tool to prevent respiratory transmission of this virus. We have very good models that show that there's a great interaction between masking and vaccines so that you can actually add your protective benefit. You get a reduction from 70% with the masks, you get a 70% reduction with transmission from vaccines, and you add them together, it gets down to 94%. That's something that's worth remembering. And, we talk about masks being oppressive. Some people say that. Let's look at Kiev. That's oppressive. Kids have no problem keeping their masks on. We've been doing it for 2 years. I think we can do it a little bit longer and show a sense of caring, a sense of respect and responsibility to one another.
For sure. Hey, Dr. Sharkawy, you and I are talking in this scenario where I'm at home because one of our kids has COVID right now. So we are still in the midst of this pandemic. Thanks for joining us today.
Thanks for having me. Stay safe.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.